now let's move on to the next part of this uh, presentation, which is going to be showing a really, really cool, amazing example of what this treatment can do to someone's brain. So we're going to go over that. And I'm going to give you some background of this person so that you have a picture, a mental picture of who this person is as a patient. This is at the time of testing. This is I believe this was a 37-year-old at the sort of early on parts of treating, but it's been over the course of 2 years, roughly between ages 37, 39, that this person has been doing treatment for CIRS. And this is a female. So female 37, 38, 39-year-old person. Just to give you some background before we jump into the brain stuff, historically is a person who has very high TGF-beta 1 and very high MMP9. So a lot of cytokine activity from the innate immune system. This 25,000, that's pretty high. The MMP9 around 1,000, anything when you're like above 900, 1,000, that's like really high. So, yep. So that's on the blood work, that things that stood out, and there's other things that I can comment on, but I just wanted to comment on those things because they're particularly tied to brain on fire, inflammation, blood-brain barrier, dysfunction, so leaky brain, things like that. In addition to that, if you look at this person's GENIE, the one GENIE that was done, there's evidence supporting hypometabolism. So there's impaired energy production, metabolic activity at the cellular level. There are markers here that are suggestive of insulin abnormality. So glucose intake is going to be impaired. And there's also markers here that indicate increased risk for pulmonary fibrosis or pulmonary hypertension, which can then lead to structural damage in the upper respiratory tract. This is a person who has, per the GENIE results, immune reactivity to all three categories: actino, endotoxins, and mycotoxins or mold. Those are not necessarily the more common cases. Very often you're going to see people showing just actinos or endotoxins, or maybe those two. And then a subset will show mold or mycotoxin, but this is a person who was showing reactivity to all three categories. There's evidence for antibody production deficiency, so we know that there's immune dysregulation on both sides, on the innate immune system and on the adaptive immune system. There's also high risk for really adverse mood disorders, depression, extreme anxiety, PTSD, and even suicide ideation. And there's also evidence for histamine dysregulation, and this person does have a very extreme profile of histamine issues. And then a few additional things that I think are important for this person is that this person did test positive for tick-borne illness more recently after doing roughly a year of the Shoemaker Protocol. So this person started VIP, and then within the VIP timeline, discovered there was a tick-borne thing. Babesia is the number one suspect as of now, and that's what's being treated. And this person also has a history of actino colonization in the skin, right? So if I'm looking at this as a whole, I'm seeing a patient who is very hyper. It's on the extreme end of certain aspects. And I know subjectively, this person is very, very, very hypersensitive, very hyper-reactive to the environment. So it's one of these harder to manage or understand cases and by some of these metrics. And then we're going to overlay that with the brain because that's what we want to focus on. So if we look at the surviving mold report, this was a scan done in 2023 at the beginning of 2023. So I think this was before starting treatment, if I'm correct. And I believe this was before starting the Shoemaker treatment more formally. This person was showing 3 brain regions atrophied, lateral ventricle enlargement with an asymmetry, and I have it highlighted here. And so what this suggests off the bat is concussion, TBI history potentially, and maybe endotoxin injury when you look at all these things together. So there might be a history of that in the report. So that's part of this assessment with the surviving mold, but there's more to this brain that is not being picked up by this surviving mold analysis report that I think it's really important. So this is the Triage Brain Atrophy report that was done again in March 2023 before the report. And I'm going to go over different sections just to highlight some things here. And you're already seeing a lot of coloring, which means, yeah, there's a lot going on here. So the first thing is this is basically tilting on the whole brain atrophy. So as I mentioned, right, I was talking about my brain and whole brain atrophy, and I'm thinking at one level there could be some developmental layers to that. There's actually in this case white matter swelling, which is actually a pattern, and it's all the way up to 99th percentile, so it's full-blown enlarged, the white matter tracts, which is very common in dementia and stroke cases. You tend to see that pattern. It doesn't mean that this person has like a diagnosed dementia. It's just a brain pattern that you tend to see correlated with these kinds of diseases. And then there is massive widespread cortical atrophy that might be likely due primarily to accelerated CIRS. And the surviving mold report was picking up on this already, that there's a pattern of atrophy. It was just picking up, I think, 3 brain regions, but because we have here a breakdown of more brain regions, we can see this is very widespread. It's all over the cortex, the outer part of the brain, frontal lobes, your parietal, occipital, which is in the back, temporal lobes. All of these regions are showing systemic pattern of atrophy, and they're all in the 1 percentile. So it's pretty much it's hit rock bottom in that sense. And then the last thing I want to say is the cerebellum, which is a little small part in the back of your brain and that looks like a tiny brain. The gray matter for that part of the brain is atrophied, and that's actually commonly seen again in dementia, Parkinson's, and alcoholism. So overall, I'm looking at this report, and when I first saw this report, and I still do to this day, I was like, wow, this is like the most extreme picture I've seen of a patient when you pair the brain reports with everything else. It's like this is like a very, very extreme case of someone who has a history of extensive brain abnormalities that you can start thinking or qualifying as brain injury that's been taking place here. So there's history of traumatic brain injury. There's history potentially of something like endotoxin exposure. There's widespread atrophy in the cortex. Right, and this is coming from the TBA report, the Triage Brain Atrophy report, which is separate from the CIRS diagnosis, right? This is a completely separate test that's picking up on these abnormalities, and this is essentially a 37-year-old female, right? So this is not like a 60-year-old or something like that. So quite extreme, if you ask me. In fact, it's to me, this is the most sort of extreme version that I've seen of brain abnormalities at a particular time point. Now let's talk about what happened roughly, a year and a half after starting the Shoemaker Protocol and doing a couple other things, but basically doing the CIRS treatment. So March 2023, we talked about the whole brain. I kind of alluded to this brain region, the forebrain parenchyma. Just think of those as general measures of brain volume more generally in the brain, right? So they were atrophied. Look what happened. Now those very same regions are now 46, 58 percentile. That's insane. That's essentially a 7-fold increase in brain volume over a period of a year and a half. It's actually amazing if you, right? Because the goal here of this treatment is if you're like below 5th percentile or hovering around that, the goal for this treatment is to start moving you away from those extreme cutoffs. So if this became like 10th percentile, 15th percentile, that's like a huge win. It's like a celebration that it's like amazing. You're moving away from that extreme. This person made it to the point where by these metrics, you can't tell apart a healthy brain from this brain from a healthy brain of the same age. So, right, it's hovering right around that very prototypical common number, right around the 50th percentile, which is insane considering where this person is coming from with the illness. Very, very low rock bottom type of situation.